injuries were in Bekaa and the suburb of Beirut and Tyre. Most of the injuries are in the face, hand and in the stomach. There was a massive coordination between the emergency room and the ambulance teams. We have told all hospitals to receive the injuries without delay.
Dr. Firass Abiad is the Minister of Public Health in Lebanon. We'll get further details from him now as he joins us. Dr. Abiad, thanks very much for being with us on TRT World. I wonder if you could tell me, first of all, just give us a kind of a status update, as it were. What more can you tell us about the injuries? I know you said in the press briefing it was just under 3,000. And talk a little bit about the extent of their injuries and how serious they are.
So thank you for having me. We are reporting that we have almost 2,800 injured. 12 are dead, including an 8-year-old girl and an 11-year-old boy. Out of those injured, we have around 300 in critical conditions and 450 who required surgeries for whether facial injuries or whether hand injuries. And a large number of those who do have life-changing injuries in the sense that they might lost their eyesight or the use of their hands. We still have a large number of patients who are admitted in the hospital, almost 1,800 patients still admitted.
And how well equipped are the hospitals and the health services in Lebanon to deal with this? I know you had a lot of people, extra doctors and supplies coming in from outside the country. How well situated are you now on that front?
Well, the major issue was the fact that we had almost less than 3,000 casualties that presented to our emergency rooms in a period of about half an hour. And this kind of mass casualty that presented really was the main challenge. Now, we have been doing drills and preparing since the start of the events in Gaza for this eventuality. And the health system was able to cope because of the practices that we've been doing and also because of the coordination. But what that meant is that almost 90 hospitals had to be involved within receiving those patients, and we've had to disperse those patients all across the country. Sometimes we've had patients coming from the South Lebanon have to be transported all the way up to the north to be able to make sure that they have access to good medical care.
And how well equipped, I mean, what is your greatest need right now as far as the hospitals in Lebanon and the supplies and so on?
I think the major issue is that most of the injuries that we are seeing are injuries that are medium to severe and mainly in the face and the hand. And that means that you require a kind of specialty, whether it's in ophthalmology, eye surgeons, or whether it's in hand surgeons. One of the things that we've, yesterday was a bottleneck is the amount of, for example, microscopes that hospitals had in their operating rooms. But we have been able to, I think, absorb this. And at the moment, what is important is, making sure that those people are recovering. Now, we've had support and we've had calls of support from several countries in the region, including from Turkey, from Iran, from Egypt, from Syria and Iraq. And medical supplies have started arriving in the country from some of our close friends.
You mentioned Turkey there. I was wondering if you could talk a little bit, if you're able to, about the kind of help that you've been getting from Turkey.
So the foreign minister actually contacted the government and they offered all help, whether it's in the form of medication supplies or in the form of medical expertise. And even if there are cases that might need to be triaged or evacuated to Turkey for that kind of care. Now, up till now, we have been able to absorb this, but the support is much appreciated.
You mentioned earlier, I believe, 12 people have been killed as a result of these attacks. Do you fear that that death toll may rise given the extent of some of the injuries?
Yes, unfortunately, we do still have a large number of patients in critical conditions in those hospitals. And my fear is that indeed some of those patients might not survive. But, this is a dynamic situation and we have to wait and see. They are receiving good medical care, but we have to see how their injuries develop.
And there is obviously a fear, not just in Lebanon, but throughout the region, that this conflict may escalate as a result of these attacks that happened on Monday, and specifically the clashes between Hezbollah and Israel across the Lebanese border and into Lebanese territory. There is a fear that could increase. Are you concerned that if that happens, if the Lebanese health system and the hospitals are sufficiently equipped to handle that?
Well, of course, we are very concerned. This event happened, this incident happened at a time when there are some efforts in the region to try to find a diplomatic solution. I think what Israel clearly did is a slap in the face of some of those envoys who are coming to try to establish this kind of diplomatic solution. It's very clear that this is a step in the right direction, and this is a direct escalation. At the end of the day, this is an indiscriminate attack because a lot of the people who had those pagers are non-combatants. And there was no way for whoever was perpetrating this to know who will be having those pagers. And therefore, you could see from the injuries and who was injured, including the children, that this is an act of aggression with indiscriminate nature. So I think that, unfortunately, this means that will be seen. It is being in Lebanon. The impression is that this is an escalation. And unfortunately, we are worried that we will see, consequences for such an act.
We also reported that the Iranian ambassador to Lebanon was one of those injured. I was wondering if you could update us, and I appreciate that there are medical confidentiality issues here, but if you could talk broadly about if you could give us an update on how he is doing at the moment.
Well, I prefer not to go into individual cases, especially when it relates to political figures, and we leave that up to the concerned authorities to comment on that.
All right. So if I could ask you then, just finally, how long generally do you expect to be able to discharge some of these victims, given the extent of their injuries?
This is a good question because, if we compare this to the Beirut explosion, in the Beirut explosion, we had 6,000 injuries, but 80% of them were actually superficial, and we were able to discharge them on the night of the explosion. These patients, we're talking about 2/3 of those patients who required admission to hospitals, and the nature of the injuries are more severe. And my expectations is that some of them might, require a bit more time. And we are concerned about their rehabilitation. We do believe that some of those injuries will leave scars for a very long time. It is a life-changing injury, kind of injury.
All right, we'll leave it there. Appreciate your time on TRT World. Dr. Firass Abiad, Lebanese Health Minister. Thanks very much for being with us.